This video is going to go over some interventions that may be useful for treating the iliotibial band injuries. First, we have stretching of the IT band. Bring your affected side to the back and lean away from it. You can bring the same sided arm above and to the side to intensify the stretch, and play around with the angles to find areas that need more stretching. And because the IT band is a thick fibrous connective tissue, you'll want to hold it for at least 1 to 2 minutes in each position. Next, we have hip strengthening with the TheraBand tubing. So first, I'm demonstrating hip abduction. You might have to adjust the length of the tubing to find the right amount of resistance. So here you want to make sure that your trunk is upright and not leaning over to the side. Next, I'll be demonstrating a hip extension strengthening. So make sure you have enough stretch in the band before you start. And here too, you want to make sure that you're not leaning forward, as well as not putting too much pressure in your low spine or your lumbar spine. And next is going to be a combination of those two movements, abduction and extension. So it's going to be bringing it to the side and the back diagonally to my left. You may progress to using a flywheel equipment for hip strengthening. A flywheel equipment provides isoinertial resistance, which allows you to get the same resistance in all ranges of movement to make gains in all angles. You can start by pulling gently as a warm-up and increase the velocity as you go. The faster you pull, the higher the load will be in the eccentric phase, in this case when the leg is going forward. The flywheel also allows for eccentric overload, which is known to increase muscle mass and strength more effectively compared to just concentric or your traditional concentric and eccentric strengthening. For more detailed benefits of using the flywheel equipment, click the link below in the description section. A general dosage of strengthening exercises would be 2 to 3 sets of 7 to 10 repetitions. While there is no research to support that regular foam rolling will be useful in the prevention of IT band friction syndrome, a foam rolling sequence that includes the hip and the knee complex may potentially be useful for injury prevention as opposed to just foam rolling of the IT band. Some of the muscles I'm targeting here include the lateral hamstrings, glutes, and lateral quads. You may choose to include the gastrocs as well. Play around with the angles to find areas that feel tight and adjust the pressure by offloading the body weight from the affected side to other limbs if foam rolling causes severe tenderness. As for duration of rolling, you want to do at least 2 minutes for each region or until you feel the tightness or tenderness decrease.